I'm Diane Uher, and I've worked at Crete Area Medical Center in the acute care side for almost 30 years.
Baumann, I'm the acute care manager here at Crete Area Medical Center. I started my career in 1997. I start to lose count of how many years. And then I left for about 3 years and then came back because I love this place so much.
At first, I was her boss. Let's clarify that, okay? And she never called me Mom at work. She only called me Diane.
I always tell people it's kind of easier to work with my mom because I can be straight up with her and tell her how it should be. And she kind of takes it with a grain of salt and still loves me at the end of the day. So we work well together. Patient care here is wonderful. We work in the rural hospital, so we see from babies to elderly. I can deliver a baby in one day and, deal with a death at the same time. I've done that before. So it's very wide variety.
I've worked here for 30 years. You get to know people. And it's great when you can fix everything about them and they go home and have a good life. But sometimes those times aren't what they want to be. And it's hard to see them suffer. Or people you work with, their families are here, we take care of their families. It's just, but also, I guess that becomes rewarding too. But it's sad. I've lost nieces and had to help their parents lose their child. That was really tough.
That was probably one of the toughest time in our career. Our family member came in with a drug overdose, and they were coding her, and we had to be there with the family. And
we had to be the family.
We had to
because
be
the family wasn't here.
Yeah.
So we had to call them on the phone, and we had to say, no saving. And that is rough.
Our family, with my cousin, when she passed, they were really grateful that my mom and I were here with them and to help ease that pain that they were having and educate them on what was going on and what were the possibilities and things like that. We have time to kind of give that one-on-one care here. We don't have aides or anything like that, so when you're a nurse on the floor, you do everything for that patient, from their basic needs of bathing to the care plans of nursing. So we just are of a holistic care, and I feel like that's what draws me to working here is that we get that time with patients and that holistic care.
Every day I learn something. I don't think, been stagnant. Not just because they make you do CEUs and all those things, but you just learn what's important, and what it's been is the patient care, and I love them.
I love that it's a thankful job. At the end of the day, most patients are very grateful for the things you do for them.
Taking care of people and them thanking you is wow. Can't beat it.